Namaskar, hello and welcome to this special interaction at the Week Health Summit in Delhi. Today, IndiGlobal Media Network is a strategic media partner here. We have a special guest who is the Chief Coordinator for Antimicrobial Resistance, use of antibiotics, Dr. Ravindra Agarwal, the former Chief Coordinator for AMR with the Government of Delhi. Thank you, sir, for joining us.
Thank you very much, Sudheer ji.
Can you give us your background and your work so far?
Okay. I've been working with the Government of Delhi for many years, and based on the global action plan in 2017, the Government of India launched the National Action Plan for Containment of Antimicrobial Resistance. And following the National Action Plan, Government of Delhi in 2020, precisely 3rd January 2020, launched the Delhi State Action Plan by the name of SAPCARD, State Action Plan for Containment of Antimicrobial Resistance in Delhi. As you know, antimicrobial resistance is a very important topic both at the global level, at the national level and at the state level. WHO has been advocating many steps for containment of the antimicrobial resistance. As you know, these days, if you see the reports of many patients, most of the samples, say maybe urine, maybe pus, they are all resistant to almost all the antibiotics. Now it is very difficult for the patient which antibiotic to take for its treatment. And it is very difficult for the doctor also which antibiotic to prescribe. So it's a very catch-22 situation, very serious situation, and we must address it earnestly both at the government level and at the community level. And one of the prime reasons is the misuse and overuse of antibiotics for very small ailments, and which leads to the antimicrobial resistance. And secondly, the use of antibiotics in the animal sector, particularly in the poultry sector, in the farm sector, in the fisheries sector, which is also giving rise to a lot of resistance in the human population.
So, this, as you already mentioned, there's a lot of resistance that has developed in regards to the antibiotics, and most of the common citizens these days go to the medical stores and seek antibiotics on their own based on their past experience. What is the do's and don'ts for the general citizen?
For general citizens, it is advised that please do not take antibiotics of their own. Please do not take antibiotics for small ailments, for common cold, for small sore throat, for the allergic skin conditions. Please do not take antibiotics. Always consult the doctors and take the antibiotic as per the doctor's advice, not as per the chemist's advice.
So, what is the hindsight behind using antibiotics on their own, and what is the action plan the government has in future?
It has been seen that most of the time when patients they go for self-treatment or take antibiotics of their own from the chemist, they do not adhere to what we call as the antibiotic stewardship program, where we have to take the antibiotics, we have to take at a certain interval, we have to take for a certain period of time. What the general public is doing, they take the antibiotics, they get relief and they stop it. And that is a prime reason for antibiotic resistance. So always consult the doctors, and once you start the antibiotics, then you complete the course. Take it for the full course to prevent the further infection, and the antibiotic will be useful for later time to come.
So what is the government doing in this front to stop or else the resistance that is developing?
The government, like I can say for the state government, it has already launched the state action plan in 2020, and government is taking steps to in fact educate the public. Awareness of the public is very important, and for that matter, we from the government of side took a massive exercise with the school children, where in 2 years we created awareness among 9 lakh school children in Delhi. And this awareness message goes to the parents, and then it becomes a big figure. Then secondly, government is now educating the chemists not to give antibiotics to the customers who are visiting them. And third is that now a red line campaign has come, where all the antibiotic strips will be marked as red line, so that once patients or the customer sees it as red line, that means it is red line. Don't take it yourself.
One last question, sir. These days, few of the drugs have been banned, including the most commonly used cetirizine or some other drugs, Dolo. What is the current scenario?
See, these are the general use pharmaceutical drugs like paracetamols, and the government is of the opinion that the combination drug should not be used. So now they are saying that if you want to use any drug, use it as a single drug. Paracetamol may be used as paracetamol, may not be in combination.
Not the combination.
Combinations. So this is the approach of the government.
Thank you very much, sir. IndiGlobal Media Network, taking innovation, collaboration, and growth to the forefront.